Hi everybody, we're here at AlterG headquarters where we change the way the world rehabs. So what I wanted to talk to you about today is the shift in paradigm that we're seeing in rehab, where people are moving away from rest, immobility, and encouraging movement. So there's a paradigm that physical therapists, athletic trainers, rehab professionals use called the RICE principle. What we do is we encourage someone to rest to allow an area to heal. We also tell them that they may need to ice, compress, elevate to control swelling so that that area can move on to the road of recovery. What we want to discuss today is that very first method, rest. We're seeing people shift away from rest because there are a lot of consequences that occur when you immobilize someone for too long. So when someone is not mobile, there's problems, but it is sometimes necessary. So I'm not saying eliminate it completely. All depends on the situation, the diagnosis. You know, if you got a fracture, you're going to be casted. If you had an Achilles reconstruction, you're going to be in a boot. So it is necessary. And you want to immobilize to control inflammation. You want to immobilize to allow for healing. And you want to immobilize to prevent compensatory problems. If someone's walking with a limp, they can get problems up the connective chain, into the hip, into the lumbar spine. So you definitely don't want that to happen. Ankle sprains, we see that a lot. People are immobilized, and it's okay. But now what we're noticing is people are allowed to move sooner, especially out of the planes of that injury. Here's some of the consequences of immobilization, why you don't want to do that too long. People can get joint stiffness, they lose flexibility, range of motion, they get atrophy, decreased strength. And if you're not loading a lower extremity, you're not loading joints, you decrease your proprioception. One of the thought leaders in physical therapy, the designer of the functional movement screen, Gray Cook, says you want to move well and then you want to move often. So definitely do that with your patients. And we're seeing this change even now. People are moving away from that rest, and this new paradigm that we're noticing is involving controlled mobility. So what people are doing is getting people moving up sooner, quicker, faster, because we can eliminate those problems. Some of the ways we're doing that and why we do it is because we decrease pain. So if someone's moving sooner, we can get rid of swelling. So we definitely see that with our rehab protocols. Post-total knee, people are walking the first day, the next day, so they're up. That reduces the likelihood also of blood clots, DVTs. So there isn't this lag time now, post-op, post-injury. Yes, you do want to protect healing tissue, but you also want to prevent joint stiffness. So after surgeries, we're also seeing people use CPM machines, which get them moving without stress to those areas. And the other benefit is if we can restore range of motion, if we can improve strength, if we can normalize gait, then we don't have the consequences, again, of those compensatory problems. There's not going to be as much limping, or they'll be doing it for a shorter amount of time, and they can move forward to the next phase of rehab. Anti-gravity treadmills are great tools to help people with controlled mobility. First of all, you get controlled weight bearing or controlled loading that you can't get any other way. So when you get someone in an anti-gravity treadmill, you can unload them all the way down to 20% of their body weight in 1% increments. So you can find that exact level where someone is pain-free. If pain-free, that means less compensation. Less compensation, fewer problems. You can start closed connective chain exercises earlier, so you can get someone into standing. You know it's going to protect that healing tissue. If they need to be partial weight bearing, 25% body weight, you could do that in the anti-gravity treadmill. Safe proprioceptive training. So again, because they're up on their feet sooner, they can do squats, they can do single leg stance activities, they can work on weight shifting. They're going to be working on all these things sooner than they could without the anti-gravity treadmill. The result, hopefully, is we get them to a more comfortable gait sooner. And if they're walking more normally, you're not going to have compensation. So you don't have to worry about problems into the hip, into the lumbar spine. So if you can get someone moving sooner and they have less complications, the hope is that they get improved clinical outcomes. So this new rehab paradigm is moving away from rest, and we're encouraging people to move more. And we see that all the time. People are moving, again, if it's a problem with an ankle, They're not stressing it into the plane of the injury. They might be staying in the sagittal plane where it doesn't flare up the ligaments that have been injured. So what we want to encourage people to do is to move better, because then they're going to feel better, then they'll perform better. So remember that when you think about rehabbing your patients.